So we're going to start our next panel. And for this panel, we're going to take a broader look at the intersection of social determinants of health and oral health. So there's many factors beyond dental care that impact dental health. And conversely, we know that oral health impacts someone's physical, mental, and even interpersonal well-being. So in this panel, we can take a more holistic look at these factors and learn about the work being done by incredible advocacy groups around the state. Together, all our work fits together to build a healthier Arizona. So it is my pleasure to introduce this panel's moderator, Dr. Scott Howell. I do see that everyone is on, but first, before we continue with the panel and before we do all the formal introductions, we do have a poll that I believe, Brianna, you have to launch for me. I don't think I have that set. It should pop up in a few seconds. Yes. So our participants are welcome to answer this poll that asks, outside of oral health care, what needs do you see or experience the most with the populations you work with or that you experience, or your friends, your family? What needs beyond oral health care do you see the most? And we have quite a few options. And if you have any other needs that you see, please add it in the chat. This is not a comprehensive list at all. So while you're answering that poll, we'll give a few more seconds. I will introduce our moderator. So Dr. Scott Howell is an associate professor and director of public health dentistry and teledentistry at ATSU University, Arizona School of Dentistry and Oral Health. He is board certified in dental public health and an Atlantic Institute Senior Fellow for Health Equity. Dr. Howell's work has two primary focuses. One, using telehealth connected teams to facilitate the delivery of oral healthcare services. And two, identifying, oh, my notes went away, sorry. Two is identifying systemic barriers to care and identifying opportunities for justice-oriented solutions to address those barriers. So not only is Scott an accomplished public health dentist, but he is a dedicated advocate for systemic change. Scott, I'll hand it off to you.
Thanks, Taryn. It's good to see everyone. Well, at least see names as much as I can see you. And I've really been enjoying the presentations up to this point. I hope you also have been. I know we're a small group here in Arizona, but I do feel we are quite mighty. So to get the next panel started, I'm going to just share one screen, one slide, if you will. And I'm going to invite everyone here to look at the slide, look at this map rather, and ask yourself, what does this picture tell you? If you're unable to, in case it's kind of blurry, I'll guide you through sort of what you're seeing here. But this is a map of individuals aged 18 years and older who had a dental visit in 2020. And yes, 2020 had some unique challenges that go beyond our typical years of addressing oral health. But it's the latest data we had. The darkest shade of purple here represents about 72% of the population aged 18 or older that had a dental visit. The lightest shade of purple represents less than about 52% and less. And as you're looking at these shades, I want you to, and as you're thinking of the story that this image is telling you, I want you to think of the following questions. What do the homes look like in each of the shaded areas? Where are the full service grocery stores in each of the shaded areas? How many individuals in these areas identify as a member of a minoritized community? How many healthcare offices are in each of these areas? And how many of those healthcare offices are on a public transportation line? And lastly, where is the nearest heavy industry to these areas? Big trucks, factories, warehouses, and so forth. You know, as you put together sort of what these shaded areas might look like, thinking of those individual questions, I can't help but think that, you know, we live in a very challenging country. America is challenging. We are a country that says you must be poor enough before we're willing to help you meet your basic needs to survive, let alone basic needs that would help us all thrive. And because of this, we continue to see severely different health outcomes among what is increasingly becoming a very large swath of our community in our country. I just saw a statistic today. I was watching the 1619 Project on Hulu, and it talked about how much wealth is owned by how many people in the country, and 1%, back up, 50% of the country owns 1% of the wealth. And about 10%, 10 to maybe it's up to 20%, owns 74% of the wealth. And so, because we live in this challenging society, I believe that we also have the opportunity to develop some pretty amazing individuals that come out of the woodwork and show up and say, "Not today, Satan." And if anyone knows who I'm referencing, the wonderful Ms. Bianca Del Rio developed that phrase. Well, I don't know if she developed that phrase, but that's who I got it from. And so I want to introduce a few folks who said, "Not today, Satan. We're going to do some good work." Because the individuals who refuse to sit by and watch as communities struggle, they show up. And we have 3 of those individuals here with us today. So let me change a couple things on my end so I can see their bios. So first, we have Jennifer Dangremond. Jennifer Dangremond. Sorry, Jennifer. She is the Director of Community Development at the Arizona Housing Coalition, a statewide member organization focused on leading efforts to end homelessness and advocate for safe, affordable homes for all Arizonans. Jennifer has over 20 years of experience in grants and program development with a focus on homelessness, housing, intellectual and physical disabilities, Indigenous communities, and safety net health providers. She's also a founding member of the Arizona Oral Health Coalition and has worked on the passage of dental therapy in Arizona and the years-long effort to add a comprehensive dental benefit to access. And Jennifer may not remember this, but she was actually one of the first oral health stakeholders I met on my career in dental public health. And I've seen her do amazing work in various organizations, and it's an honor to be here 10 years later with her talking about social determinants of health. So Jennifer, thank you for joining us. Our next panelist is Ashley St. Thomas. Ashley is the Director of Public Policy at the Arizona Food Bank Network, which has a mission to end hunger in Arizona through food banking, public policy, and innovative programming. Ashley joined the Arizona Food Bank Network in 2017 and has led numerous state and federal advocacy campaigns focused on making healthy food accessible, affordable, and equitably available to all Arizonans. Prior to joining the Arizona Food Bank Network, Ashley worked on international food and water policy at ASU and the International Food Policy Research Institute in DC. Ashley, thank you for being here. And lastly, we have Alison Lovell, who is the Business Operations Administrator for the Arizona Advisory Council on Indian Healthcare. She is also a nationally and state certified emergency medical technician and NASM certified personal trainer with experience working in underserved communities during the COVID-19 public health emergency. She holds dual degrees in healthcare administration and general services, has served as an EMS and telehealth subject matter expert, and as the state Medicaid programs policy and education manager for fee-for-service populations. Most importantly, she is very passionate about dental health and the rights of all to have access to oral health care. So again, and thank you, Alison, for being here. So welcome to all of our panelists. It's an honor to get to moderate the panel, and we'll get started with the first question. So we'll go Jennifer, then Ashley, then Alison, just in the order that we introduced. Can each of you talk a little bit about the work you do within each of your organizations and how your organizations are part of the larger social determinants of health and social safety net network? Jennifer.
At the Arizona Housing Coalition, we are really supporting our members who are the providers of emergency shelter, street outreach programs, building affordable housing, standing up the hotels that are part of the process coming off of COVID. So we're really seeing individuals who very marginalized, very without services, lack of connections to care, and run the gamut from being on the street a day because they just lost a job to folks who have been on the street for 10, 20, 30 years, substance abuse, chronic health conditions, and really a lot of individuals, it's all come together. So all the social determinants of health fell apart for them. And now they're experiencing homelessness and more across Arizona, housing instability due to the higher rents. So it really becomes, you know, do I pay for the dental visit? Do I pay for food? Do I pay for rent? And more you see larger segments of the population being impacted by that, including folks that are elderly, seniors living on very fixed incomes. So in my sector, like a lot of your sectors, we see it all playing out daily on who we're serving and supporting.
Thanks, Jen. I had students come back to me one day after they had met with individuals experiencing poverty, and they said, so they're 6 days away from getting evicted, and I don't know how to help. So thank you for being there for folks. Really appreciate it. Ashley, how about you? What are you doing within your organization?
Well, first, let me just say thank you for hosting this, for including the Food Bank Network in the conversation. Scott, for your intro, I couldn't agree more with all that you said. And just to be on this panel with these folks who were all part of the Basic Needs Coalition, so you can tell that we overlap and there's a lot of intersectionality in the work that we do. So I'll just talk a little bit about the Food Bank Network and then about the work that I do. And then I don't know if folks are already familiar with us, but if you're not, here goes. So Arizona Food Bank Network has been around in one way or another for the past 40 years. And we're a coalition of 5 member food banks, 3 here in Maricopa County, 1 out in Yuma, and 1 down in Tucson that work with about 1,000 partner agencies. So some of Jen's housing sites and community centers, senior centers, domestic violence shelters, any direct service provider to get food in need to people across all 15 counties. And so in 2023, the network collectively served 550,000 people per month, which I've been here almost 7 years, and it's definitely never been that high. For reference, that's 20% higher than pre-pandemic and about 14% higher than 2022. So obviously the need keeps growing. I think we're all well aware of the various things at play that cause that to be happening. But our food banks, they're just deeply embedded in their community as well. They're not just providers of emergency food assistance. But I'll talk a little bit more about what they do to get fresh food, fresh produce, and healthy fresh protein out to people in need in a little bit. But the work that I do is focused obviously on policy and long-term solutions. And so that looks like state and federal campaigns that really kind of strengthen, or just to be quite honest right now, protect some of those programs. So the Supplemental Nutrition Assistance Program, formerly known as food stamps, and school meals in particular. And that there's a state campaign that kind of is how I came to know the Arizona Oral Health Coalition through Children's Action Alliance and Brianna, that we worked on together to get some state funding for school meals. And so that's something I can talk about in a little bit too, but it's just a little bit about what we do.
Thank you, Ashley. And my first connection with the Arizona Food Bank Network was when I didn't have any cash on me, and I was looking at someone who had a sign up saying, "Hungry, please help." And something I personally took on was anytime I see someone, I try to remind who might be asking for help with food. If they're asking for cash and I don't have any, something I like to do is just go right to the Arizona Food Bank Network and donate some money. And I know that we all don't have, not everyone has money to donate, but if you do, I'm sharing the link that will take you directly to the Arizona Food Bank Network donation site, because when you see someone, if you want to do like I do, if you see someone who's out there experiencing hunger and you're unable to help that individual, you can help networks to help people. So I encourage folks to consider that. So thank you, Ashley, for being here.
Thank you, Scott. You're doing my job for me.
And she didn't ask me to share that link, so that was unsolicited. That was me wanting to share that as an idea. Alison, can you let us know what you're doing in your organization?
Yeah, sure thing. Good morning, everybody, or rather good afternoon. Sorry, been up since 4, so my times are blurring together now. My name is Alison Lovell. I'm the Business Operations Administrator over here at the Arizona Advisory Council on Indian Healthcare. So we are actually a state agency. We were established by Arizona Revised Statute 362902.01 to give tribal governments, tribal organizations, and urban Indian healthcare organizations in the state representation in shaping Medicaid policies and other healthcare policies and laws within the state. So we first got involved with the Oral Health Coalition. You got to sport the swag, of course, because oral health is a very big concern in Native communities in Arizona. And it's been pretty much a priority of our board members for as long as I've been with the council. And then many, many years before that, our prior director, Kim Russell, she had been working at the Oral Health Coalition pretty extensively on different attempts to try to get a new bill to support comprehensive dental for Medicaid members through our legislature, which is definitely an ongoing battle to try to get that because it's a basic right. So our organization, we do a lot of work in different areas. We work a lot with the community health representative organizations that go out into the community and provide education on resource connection or how to take care of yourself, or hey, if you have a particular health condition, these are the steps that you can take to improve your overall health, or here are things that you can do, preventative steps to prevent a health condition from getting worse. And that obviously includes oral health, taking care of your teeth, taking care of your dental health as much as possible. Additionally, risk factor work. We do a lot of health education around risk factors. So I think everybody on this call is pretty familiar with the fact that smoking is a huge risk factor for the development of any kind of oral or throat or tongue cancer. So we do a lot of education on that because a lot of people are not really honestly aware, especially in rural areas, that puts them at high risk of cancer. And I've talked to quite a few people who didn't even know those were types of cancers you could get. They'd never even heard of them. So, or at least they haven't heard of them until they get them or a family member gets them, which is unfortunate because there's steps that can be taken. And our organization, we try to do a lot of work with the state Medicaid department, Access. They are wonderful for us to partner with. And we actually had the opportunity to look at 21 million lines of healthcare claims data. And that included some dental data, but there are some challenges in the dental data that we can look at because of how IHS and 638 facilities report that data when they're submitting healthcare claims. But working around that, we were able to find the most common social determinants of health for our particular populations, which are the American Indian and Alaska Native populations throughout our state. And the number one is tobacco use, which obviously has a huge effect on oral health. The number two is pretty consistently homelessness, which also can affect whether or not you have the resources or ability to take care of your oral health. And then we have a plethora of other social determinants of health, not always related to oral health, but just to give you a general idea of our population. Challenges, extreme poverty and poverty are two very high social determinants of health. Sheltered homelessness, which is not being completely homeless, but having a place that you can stay that is not your home, a temporary shelter. Disappearance and death of a family member. A very disturbing number of the healthcare claims we look at have that listed. So that's just a continual stressor. And a lot of the times people have reported that when they're trying to find a potentially murdered or a for sure missing relative, that everything else just kind of goes by the wayside. They don't care about keeping primary care appointments. They don't care about their dental health. They don't care about anything else but finding that person. And these are things that can take years to try to find what happened to their relatives. So there's also a lot of individuals out there with a feared health complaint, but they are scared to access the healthcare system because of not just historical trauma, but recent trauma. For those who are familiar with the sober living home and behavioral residential facility situation going on in Arizona right now, the fraudulent providers specifically targeted American Indians and Alaska Natives. So that has unfortunately really heightened the fear of our communities to access healthcare, including oral healthcare, because there's a lot of distrust in the system that has been reawakened. So we do a lot of health education around risk factors, how you can take care of, all your health conditions, mental health, how different health conditions can affect your oral health, like diabetes, heart disease, different cancers that could really affect your oral health overall. And then trying to reinstill that trust in the different healthcare systems and connecting people with health insurance and resources so they know where they can access it if they do have that access to oral health. Because a lot of the ITU systems, they have oral health in different areas, or there's at least some spot that they can actually access that. And for those who aren't familiar with that, For American Indians and Alaska Natives, they are the only population actually in the whole US that is entitled to healthcare by federal law. So the Indian Health Services, they provide certain types of healthcare, and some of the facilities do have dental. Then there are also the tribally owned and operated 638s. So those are tribes that said, hey, we know we could have an IHS facility, but we would rather operate it ourselves. So they receive that funding from the federal government to operate that themselves, and then they can open dental clinics, things like that. That's usually where we see the most dental clinics, actually. And then urban Indian health organizations, those tend to be in the cities, like Tucson, Phoenix, more urban areas. And sometimes they will have different types of dental clinics. So just trying to connect people, resources they'll trust so that they will actually take advantage of that. Because in the wonderful, I love that you showed that diagram before, Scott, because the areas where nobody's accessing really dental tend to be areas where reservations are located. So just goes to show our people are not really accessing a lot of dental when, even if they have the opportunity due to that distrust. And transportation is another social determinant of health issue. Rural roads, lack of transportation. People may not have a car that can get them there, may not have a relative to take them all the time. So missed appointments are a big thing, even if they do have an appointment. So that's kind of what we're doing, trying to provide education, resource connections on those areas.
Thank you, Allison. Yeah, I think Kevin Costner lied. If you build it, doesn't mean they will come. And I had a colleague say to me, oh, my friend works at an Indian health clinic and people don't care about their health. They never show up for their visits. So do we really have an access to care issue? I mean, there's a clinic there. And my colleague was coming from a place of inquiry, but it came off a little insensitive. But at the same time, I think he just didn't realize that access to care doesn't mean a clinic is there. Access to care, I mean, Allison, you summarized so many of those issues, and just the idea of what is my focus right now? And if my focus is finding my missing loved one, then nothing else matters. If my focus is staying in my home so that I can have a place for my children to be safe, nothing else matters. And that's where I think people miss the concept of the social determinants of health is how can people focus on all of those things when we live in a society that says you have to focus on all of those things in order to survive in this society, and good luck if you can't make those things happen. It's your responsibility. But like you said, tribal communities, indigenous communities, American Indians, Alaska Natives, it's the only one that it's in federal law that we have to provide these services, yet these are the communities with some of the worst health outcomes. So the law isn't the only thing that's going to make it happen either. So thank you, Alison. We'll go into the next set of questions here. And I actually want to go sorry, I lost my train of thought. I want to go to Ashley first for the next question, because we want to know more about how you've seen oral health or oral health challenges or challenges accessing oral health care show up in the work that you do. Particularly as it relates to nutrition, which is so crucial. We can't get cavities unless we're eating sugar, for example, yet so often people's only access to food is carbohydrates, because those are the things that can be saved. So Ashley, would love to learn more about what you're doing and what you've seen in terms of oral health or challenges accessing oral health care show up within the populations you work with.
Yeah, thank you. That's a really good point. And I think a large sort of misunderstanding also about food banks, which I appreciate the opportunity to sort of address in an indirectly, but our food bank network has made an incredible focus. It's been a huge focus to increase the amount of fresh produce that comes through the network so that it gets distributed to folks. And I think you're exactly right. Nutrition underlines a lot of, oral health is just health, right? Mental health is just health. It's all related, and nutrition is the backbone of everything. So over the past few years, we've been able to increase the amount of fresh produce that gets distributed to families through food banks. And we operate the Friends of the Farm program, which is a farm to food bank program that launched April 2020, just right when the pandemic hit, and has seen huge growth. We work exclusively with small growers, and so keep their locally grown produce within their communities. And it also makes it accessible to families who might not otherwise have access to it because of the price point. And we've just seen tremendous great response to that program, and are continuing to try to grow it all over the state. In addition, our team I think in 2 years ago, our team down in Nogales, we acquired our first warehouse as an association, and are doing a great deal of produce rescue around the border, rescuing produce that would naturally go to a landfill, but is then repackaged. We're one of the only facilities in the country that has the ability to repackage sort of bulk produce into family-friendly produce boxes. And last year, I think they got out about 850,000 of those boxes. And so that's kind of what the food banks are able to do. And I don't know how they do their work. It's pretty incredible, but I'll also just speak to the policy side of things. And so Brianna and I got to work together a bit on this campaign at the state legislature this session, which is focused on getting some general fund dollars to cover some school meals expenses, specifically the family copay for reduced price school meals. So that's if you're within a certain poverty threshold, your child is eligible for reduced price meals, which means you pay 30 cents for breakfast and 40 cents for lunch. And that can be too much, families that are living paycheck to paycheck or whatever their financial situation, multiple children, that adds up. And we see a lot of students in that category not getting the sort of peanut butter and jelly sandwich while the other kids are getting hot, healthier meals. And so that has been a huge undertaking with a lot of different coalition partners. But I think, starting with kids in school, we know that that's oftentimes the only hot meal they get a day, and evidence shows the healthiest. I know it can be a polarizing statement about school meals, but it is what it is. And so making sure that more kids have access to that is one step towards increasing overall nutrition, health, oral health.
Yeah, it breaks my heart to know that there are kids out there going hungry. I mean, it's just no kid should have to suffer that kind of fate. But again, thank you for doing what you're doing to ensure that kids don't suffer that fate. Jen, I wanna talk about housing. Thank you, Ashley. I'm curious from a housing perspective. When I lived in Seattle, there was a housing program to help individuals dealing with alcohol use, and they would give people living in the housing program alcohol because people were using substances to help cope. And they didn't want to kick people out if they were using those substances, but they wanted to help people. And interestingly enough, as they got people housing settled, they didn't want to use alcohol as often because they weren't trying to cope with substances. But it was very controversial because they were, getting free alcohol in the program. But again, it came back to, well, do we want people to live in stable housing? This is a way to do it. So anyways, I don't know if you're going to talk about any unique programs, but I just thought that was an interesting approach. But how about in your work and with housing challenges that you've seen around accessing oral health care? What have you seen?
Yeah, so quick note on your example. It's called Housing First. It's not actually giving away free alcohol anymore, but it is that notion of bringing somebody in, because it's really impossible to get a handle on anything if you're living on the streets. So as a model, it's been accepted across the country for decades now. It is under fire right now. So it comes under fire with a lot of the anti-criminalization bills, or the criminalization bills moving across the country aimed at people experiencing homelessness. But what we're doing here at the coalition, one of the things that we do is we are the organizing entity for the veterans stand downs, which occur in Maricopa County and across the state. So once a year in Maricopa County for 2 days, we bring in veterans experiencing homelessness, housing instability, and sort of disconnections to care. So they come into the fairgrounds, and over 2 days, they can reconnect to whatever they need. And one of the things that's really been asked for is dental services. So in the veteran space, only about 15% of vets are eligible for dental care through the VA. And to be eligible, it does need to be a eligible service disability. So something happened while they were deployed or working within the military that caused injury or disability or something, they're eligible for care. The VA is sort of assuming that the other 85% are getting their care through their employer, or they're going to pay for the VA dental plans. What we know is that's not true. Very much so for folks experiencing homelessness. So what we're working on now is figuring out, when we host these stand-downs, what services can we provide. There are clinics like Brighter Way, and Dr. Volchek we started Brighter Way specifically to address veteran care in partnership with the VA, and then it's grown into everything else. And it's grown into everything else because there's so many folks that need dental care, and the lack of a Medicaid benefit, lack of a Medicare benefit impact how full his chairs are. There's the St. Vincent de Paul Clinic. There's a lot of different things. There's the once a year Mission of Mercy Clinic. So there's spots to get folks. It's just not timely. Many folks are using the emergency room, and that usually results in an extraction and maybe something for the pain and infection. So we're building out, and we just started this conversation, and a lot of folks may have been on my emergency email in March of this year, when the provider who was going to come in and do dental on Thursday canceled on Monday. So I put out an appeal to lots of y'all, and Barb came through with supplies. I reconnected with AZ Cares and some other provider groups. So now we're doing some planning to see what we can actually do on site. Again, it's 2 days, but we're at the Coliseum. We're not even at the Coliseum. We're in the exhibition buildings. So we could set up, portable mobile dental, but it'd be a lot. But we're also looking at maybe doing an adoptive vet type program, where we can connect veterans who maybe are in transitional housing programs with a private practice dental office or dentist, and that they can do all the work that veteran needs. I know a lot of that we can assess, and we can do, the flashlight assessments, and we can create a treatment plan. But if you can't actually get somebody in a chair, it just doesn't really help. And in a lot of cases, it just frustrates them more than anything. So we're looking at maybe doing an option like a adoptive vet program, looking at other ways to increase, volunteer engagement. And really also, I've been working on that stinking adult dental benefit now, I think, for 8 years. So we're closer and closer and closer. So maybe next year will be the year that it gets over the line. And as Jan said, yeah, there's a veterans expansion of care. It's the Vet Care Act, introduced in 2023 at the federal level. Doesn't appear to be moving forward at any rapid pace. So that's a policy piece that we're going to keep an eye on. And the veterans, when you organize them, they're a real strong lobby. So we just need to get them organized and get them going on this particular topic. And we'll be collecting a lot of stories. I mean, if you come to Stand Down, and if anybody's interested in just volunteering in general at Stand Down, I can drop a link to the connection, because it really is an amazing experience over 2 days.
Thanks, Jen. And I'm putting in the chat the link to AIDPH. Thanks for the shout out, Jan. I'm on the board of AIDPH, and our work for veterans is it's an uphill battle, but there are members of Congress who want to join us on that work. So it is slow, but progress can be slow, but there's still progress. I want to go to, thank you. I want to go to our next question. And I would like Alison to jump in. first here. And Alison, I'm curious what opportunities you see to better connect the populations you work with the oral health needs. You had in your introduction shared a couple different challenges that folks are facing. So what can we all do to help as advocates support the oral health needs of the indigenous communities within Arizona?
So it's definitely a complicated question, and there's no easy answer, unfortunately. But one of the big things that we hear over and over and over again is a lot of our population is enrolled in Medicaid. Extreme poverty and poverty, they are pervasive in our communities. And as a result, a lot of individuals have enrolled in Medicaid and have their children enrolled in Medicaid, which is good because at least they have that insurance in addition to the services that they can receive in an ITU. Now, when it comes to dental care, dental is covered currently for Medicaid members who are enrolled under the EPSVP program for the Early and Periodic Screening Diagnostic Treatment Plan for kids. But when it comes to adults, it's only for emergencies. So people literally let their teeth just like get destroyed before they will go see a dentist, before they'll go to a doctor to get that treatment covered. Even if they do have health insurance that'll cover emergencies, they'll wait. And I think someone in the chat, they summed it up. I apologize, I don't have it open, but you said gettability. We still have all those access issues where individuals do not trust the healthcare system, so they do not want to go. So ways to help. One of the ways that our agency is trying to help is to frankly get more people from the communities, people that are trusted messengers and can become trusted providers to go into oral health profession. One of the biggest things is education. We actually host the American Indian Health Area Health Education Center within our agency. So we've been helping connect students with opportunities to, become dental providers, become dental hygienists. We've been working at the National Indian Health Board to advocate more for dental therapy services because across the nation, the rules are not consistent. And one of the challenges for our tribes here in Arizona, tribes are sovereign nations. They are not limited to a state boundary. So Navajo Nation, for example, they exist in more than one state. I have coworkers who live technically in New Mexico, but they have to come into housing in Arizona to work. So there's that disconnect there of the states not all having the same type of services, which can cause confusion for individuals who are a part of a tribe that has land in both, more than one state. So we do hear that as a challenge a lot. So if we could have advocacy to try to get all the states in the entire country on the same page when it comes to providing oral health for Medicaid. I know I'm a dreamer, I like to dream big, but that would be wonderful because then it would be easy to just provide the same education to everybody, regardless of what state they live in, regardless of what tribe they were a part of, and then everything would be consistent. And the other thing is that, again, helping to provide those educational opportunities for students and letting them know, hey, you can help your community. You can help all of the Tamara, I love that. Yeah, I want to dream big. But that you can help your community if you go into these healthcare professions, because I'll be very honest, when I was working in COVID communities, I'm part of an Eastern tribe. I am obviously white passing. So when I would go into different communities, a lot of people did not trust me because of many good historical reasons to not trust someone who is not from the area. So it took a while of working in those areas before people knew who I was and knew that I could be trusted to try to help and that I was going to try to do everything in my power to help them. And then I started getting introduced during the pandemic of, oh, she's the Cherokee redhead. And then that's how I would be passed off to provide services to people. And I always thought that was kind of funny. This is all hair dye. It's out of a bottle. My hair is great now. I think it's great. I don't know what color it is anymore. But my point though, is having that educational opportunity and advocacy to provide more educational opportunities to these marginalized and underserved communities, to these communities that have health disparities. And obviously that goes beyond American Indian and Alaska Native communities. It goes for our Black communities, it goes for Hispanic communities, goes for any of our communities that are underserved within our state. So those educational opportunities, getting more individuals from those communities involved in oral health care, going into those professions would help leaps and bounds for helping to establish that trust and combat all the decades of just pain and suffering and misdeeds that were done. And that there has to be that period of healing, and that's going to take a few decades. It's going to take probably more than one generation to get done. And we have to really do that work now. So in terms of advocacy, the education, trying to get oral health care on the same page for every single state in the country would be amazing. I think our state has great people and people trying to do leadership in those areas. So I think those are two really big areas to help support it.
I love that you mentioned education. One of our graduates from the Arizona School of Dentistry just graduated last week, and he's the first member of his tribal community to become a dentist. And
oh, I love hearing that.
yeah, he told me the name of his community. I'm forgetting, but it's in Montana. And then, you know, dental therapy, what I think my dental colleagues don't realize is dental therapy is an alternative education pathway that challenges the colonialized system of education that we've developed here. So it's dental therapy is an amazing pathway for that addresses anti-colonialization pathways, and it's really important that I think people recognize the importance of dental therapy, not just as providing dental care, but creating pathways for education too. So thank you. We've got just a couple minutes left, and so Ashley or Jen, I just want to see if either of you have any suggestions, like 30-second suggestions here for how advocates in the community, how folks on the call today can help your organizations, help your communities. Jen, why don't we go to you first?
Gosh, I think in general, my biggest message right now is please be open in your community to having affordable housing built. Please be open to talking to homeless service providers about what's going on in your community. Don't feel like you have to be the person that's always giving away the cash or the water or the whatever to the person on the street, but please help us out on the system side, the advocacy side, and really right now, and actually, if you want to shoot an email off to the governor and tell her to please sign the 2 bills that hit her desk that expand the availability of alternative dwelling units, ADUs, and some of the missing middle housing, fourplexes, duplexes, like, please give her a nudge to get those signed. We need everything built in Arizona right now, and that's going to eliminate the stress about homelessness, the rising numbers, and healthcare is housing, and housing is healthcare. So that's all my plug on that.
Thank you, Jen.
Thank you, Scott.
If you can put those bill numbers and the governor's contact, if you can put that in the chat, I think that would be helpful. And Ashley, any final thoughts on how advocates can help your organization and your population you're working with?
I think, gosh, there's so many ways, but this is a good one right here. Just being here and listening and learning and participating in things like this, because I think there's still a huge misperception about who is food insecure and who goes to food banks, and you know, it's everybody. It's everybody. We see more families than anything else, and 2/3 of the people that come in are working, you know, multiple jobs, right? So I think there's an obligation as advocates to address that misperception with some folks who are in positions to make decisions. And then for a more pointed ask, I know, again, school meals, everybody has an experience with it, good or bad, often bad, but sometimes that's the only meal kids get a day. So we want to make sure as many of them are able to get it as possible. And so the funding that we requested is in the governor's budget. It is a top priority for the minority party in the legislature. So we still have hope for it, but it can't hurt to reach out to your legislators and explain why this is important to you, to your community, to oral health. And I can put some links in the chat where you can find more information on how to contact folks.
Thank you, Ashley. And that brings us to the end, but thank you to our 3 panelists to sharing any links that you can in the chat. The last link I'm going to share is my recommendation. Become a member of the Arizona Public Health Association. It's a relatively inexpensive membership, but you will have full access to Will Humble's brain. And there is no better advocacy mind, in my opinion. He does such a great job of summarizing the legislative actions that are occurring in Arizona the bills that are going through and how AZPHA is supporting or not supporting those bills. And if you want to stay on top of the health care legislation that comes up every year, become a member of AZPHA, because you will get those emails. You will find out when to reach out to your legislators, and it's a relatively inexpensive way to stay engaged with the legislative process in Arizona, and be an advocate. Because when a bill comes up that we don't want to see passed, the only way to get out there is to put your voice out there and to email our legislators. So I appreciate everyone's time. Thank you for the opportunity to moderate this panel, and I will turn it back over to the conference organizers. And thank you, everyone, and especially thank you to our panelists for sharing your stories this afternoon. I'm very grateful and honored to share this space with you all. Thank you.